Hey everyone, welcome to the Autoimmune Dietitian YouTube channel. My name's Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. And in my work with my clients, I help them use both food and lifestyle as a way to improve their symptoms and hopefully get them feeling better again. So it is the last week of the month. If you're watching this fairly recently, this is taken in April. And I'm closing out this month of elimination diets with the Candida diet. So the Candida is a yeast that is the most common root cause of fungal infections in the world, if you can believe that. And while it normally lives happily in your body, any type of overgrowth can cause a variety of problems. So today I'm going to give you the lowdown on what Candida is, how you know if you have a Candida overgrowth problem, and what dietary strategies you can use or elimination diets to help reverse this. So before I jump in, I just need to attach my usual disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes you make to your medical care. All right, so let's kick it off by talking about what Candida actually is. So Candida is a broad genus of yeast that lives in the human body. It's actually the most common cause of fungal infections worldwide. It loves warm, dark places, which is why it's commonly found in the intestines and other mucous membranes. So this yeast belongs to what is known as your mycobiome. The mycobiome is a diverse fungal community within your gut microbiome. Imagine that. So it actually forms when you are a fetus and is influenced by your mother's diet, environment, and how you are born. And then past infancy, the microbiome can change based on your diet, lifestyle, and environment. Super fascinating, right? So the microbiome also plays a really important role in maintaining your overall health. It has protective benefits from infectious and inflammatory diseases, but can also be the breeding ground for opportunistic pathogens and drive gut and metabolic associated diseases. So while it definitely helps you, it can also cause some harm. So Candida, again, a very broad genus of yeast that has over 200 different species and is one of the primary colonizing fungi in humans. Candida can protect against diseases, but if the immune system isn't working properly, as the case with many autoimmune diseases, Candida can multiply and take over. All right, so what is Candida overgrowth? It's actually not a medical diagnosis. So if you go to your regular doctor and you talk about that, they're probably going to tell you that is nothing that can be diagnosed and it's all foo-foo. But it's actually a term, so Candida overgrowth, a term that describes high levels of Candida relative to the rest of your microbiome. So there are many reasons why this yeast grows in abundance, some of which include having a compromised immune system, taking antibiotics or corticosteroids, undergoing chemotherapy, living with diabetes, pregnancy, and then oral contraceptives. Some signs and symptoms of overgrowth include genital or vaginal itching or discharge, burning during urination, sugar cravings, skin rashes, whitish yellowish plaque on your tongue, thrush, diarrhea, to name a few. So diagnosing Candida can obviously be tricky because a lot of those symptoms mirror other symptoms of other very common conditions. So the most reliable test for Candida is doing a fungal culture and tissue histopathology through a blood sample, which isn't the easiest test to get and it usually tends to be expensive. So some practitioners use stool samples to test for Candida, but those tests are unreliable as sometimes yeast won't show up in your stool. So in terms of nutrition for Candida, well, surprisingly enough, there is not a consensus in the research for an effective Candida elimination diet because, again, hard to test, hard to track, and again, sample sizes usually in these studies are very, very small. So that being said, few small studies with positive results when combining antifungals and diet. Most practitioners believe that some form of an elimination diet will help with treatment, and there's an agreement that the following are options for eliminations. High carbohydrate foods. So yeast feed on sugar and need it to thrive. So limiting sugar in your diet theoretically makes sense. to kind of starve out the yeast, right? So high carbohydrate foods includes things like all added sugars, including natural sweeteners, refined grains, corn and corn products, starchy vegetables, dried fruit, and then fruit juice and fresh fruit. But you can also include some fresh fruit, you just have to limit it. Some people believe that removing yeast containing foods can be beneficial. So this avoids more yeast being introduced into the system. Yeast containing foods includes things like bread, alcohol, vinegars, except for raw apple cider vinegar, soy sauce, tempeh, miso, and fermented vegetables. And then mold. So foods with a high chance of mold contamination are also considered as eliminations for a anti-candida diet. And these include things like processed foods, peanuts, peanut butter, pistachios, cashews, pickled or fermented foods in brine or vinegar, mushrooms, aged or moldy cheese, and then processed, cured, and or smoked meats. So, as with all elimination diets, these foods should be avoided for only 2 to 4 weeks. If symptoms do not resolve, then something else is going on or the diet needs to be tweaked. So, what else helps with candida? So, believe it or not, there are actually a few other things that you can use to help eradicate candida in your body. The first one that's really interesting is something called Saccharomyces boulardii. This is a probiotic, non-pathogenic, non-colonizing yeast that is not a normal part of your microbiome. However, this strain is very effective at supporting the immune system and lowering inflammation. It can decrease pro-inflammatory cytokines, inhibit candida growth, and disrupt the candida biofilm. Biofilm is a whole other topic we can discuss at another time. Super interesting, but yeah, biofilm also needs to be addressed when you are eradicating candida. Herbs and botanicals. So there are a handful of herbs and botanicals that can be used as antifungals, some of which include garlic, curcumin, thyme oil, oregano oil, berberine, and silymarin, which is from milk thistle. So just to recap, today we focused on candida, what it is, what are signs and symptoms of overgrowth, how can diet help, and what other things you can add into your diet to help eradicate candida. If you think you have candida or you have some other underlying inflammatory issue that you would like to address and are thinking about using food as a way to help you feel better, I would love to chat with you. I do offer free 15-minute discovery calls. You can go to my YouTube profile and there'll be a link there to book a free call. Also check out my website. I've got lots of extensive blog posts, information, free handouts, a lot of things on my website, annierubin.com. Lastly, if you don't follow me, click the little follow subscribe button. I love helping putting out these videos and helping people live better with their autoimmune disease. So click the little subscribe button. These videos come out about every week or so. So thank you for joining me. Again, I'm the Autoimmune Dietitian, and I will see you next time.